CEO Live Talks.
I am Dr. Swanee Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change, and these are the critical conversations about health in our community with the people who can help me make those changes. Good afternoon. Welcome to CEO Live Talks. I'm your host, Dr. Swanee Jett. Today I have Ms. Martin on my show, another good friend. Welcome to the show.
Thank you so much.
Well, thank you for coming today.
Absolutely. Glad to be here.
On such a brisk afternoon.
Yes. Where is our spring weather?
Yeah, don't remind me, I got to go buy some more coats for my little ones just because the weather has changed significantly.
Absolutely.
Yeah. So tell me, where are you originally from?
I am originally from Alabama.
Alabama?
Yes, sir. I am originally from Alabama.
Don't tell me you're an Alabama fan.
I am not. I was born and raised a War Eagle fan.
Okay.
But I am an SEC fan.
Auburn fan. I would take that.
I am an Auburn fan.
As long as you're not Alabama.
No.
All right. So what part of Alabama?
So originally from North Alabama.
Okay. I don't know
around the Muscle Shoals area.
Okay, now I do know where that area is.
Muscle Shoals, around the Florence area.
Okay.
Lived there till I was young, and then we moved to Atlanta.
Okay.
And I spent a big chunk of my childhood in Atlanta.
That's quite a change.
It is.
Okay.
It is. And I love Atlanta.
Okay. I do too.
And then we moved to Kentucky.
Okay.
Right before high school.
That's another big change.
It was a real big change. I was bused. I was a part of the busing era.
Really?
In the 1970s, early 80s.
So where did you live at? In
lived and still in the same area, not too far from Ballard High School.
Okay.
Ballard was my home school.
Okay.
But I was bused, and I loved every minute of it.
Okay.
I'm a graduate. I'm a Yellow Jacket.
Okay.
I'm an alumni of Central High School.
Okay. All right.
And it was an incredible experience.
Right. So did you play sports?
I did.
Okay.
I did. I'm a sports nut.
Okay.
Quick little side story. I'm the youngest of three girls, and so my father, when he realized that he didn't get his boy, I became that person.
Oh my God.
So I went to Braves games.
Okay.
I saw Hank Aaron play.
Oh wow.
Yes. Got to see Hank Aaron hit some home runs.
That was an experience.
Yes.
I'm sure. I wish I could have.
An amazing, incredibly, just neat man. Yes, I played powder puff football.
Did you?
I did.
Did you?
I did. I love football.
Well, you would have had a knack today because you see, it's like 3 different leagues for women now.
I know.
And I always thought I wanted to be careful to not get the woman hurt out there on the field. Because I know how men, we would play with helmets. I'm like, yeah, I don't know about that. But I love the flag. Mm-hmm. There's another league that comes on TV. And I got to remember what station it comes on. I'm like, I got to catch up. But I would love to go see. Because there was always a young lady that could play.
There's always, yes. Women love to play football.
Right.
So I'm excited to see that more and more women are out there and that it's getting the attention it deserves.
So when you went to, so you said your father had you involved, but so what sports did you play in high school?
In high school, I mostly powder puff football, and I did play softball.
Okay, all right. What about your other sisters?
My other sister played softball, and then my oldest sister wasn't involved in sports.
Okay. So your dad sort of left that.
My dad said, "Okay, you're gonna go to all the sporting events with me." So yes, grew up watching SEC football and baseball.
Okay, so at the time when you was going to Central, it essentially was being integrated.
Yes.
Because we're talking about in the 70s.
I was in the class. I graduated in 81. So I started there in 79.
Okay.
And it was very much integrated.
Okay.
I was a minority.
Okay.
And it was an incredibly eye-opening and wonderful experience. And I do believe it put me on the course for my career and my passion. Because I had not had the opportunity to learn how other people live.
Right.
And what it's like.
How did it make you feel being a minority at that time? I mean, because I walked in plenty of rooms and I've been a minority.
Sure.
You know, and it's always a little different, and you're trying to figure out what's going on until you get accustomed.
Right, right.
Right.
And that's what I found. I found myself very humble, very much realizing that I needed to learn. I had a lot to learn.
Right.
I had a lot to understand. And respect is what comes to mind when I think of, I wasn't in my homeschool. I wasn't in my neighborhood. I wasn't in my area. And so it was important that I show respect to those who that was their homeschool. That was their neighborhood. I was now in their space.
And you've had opportunity now, because going to Central, to see the school transform as well. And
Yes.
I used to say the track was horrible. Got a new track.
Got a new track.
The football team, the field was horrible.
Oh, yes. Yes.
So I've seen a lot of improvements, but the neighborhood has changed.
It has changed.
So that's the sad part about it, because it's totally different than when you went to school.
I used to ride TARC.
Okay.
I used to ride the TARC bus and go to school and rode it home. And we would often walk around the school, especially I had a lot of friends that played sports, a lot of friends that were cheerleaders, and we would hang around after school and do a lot of different things.
Okay.
But the other beautiful thing was other individuals who were bused into Central, we all came from different socioeconomic classes. We all came from different backgrounds. And the beauty of Central was it didn't matter.
Right.
We were all in there together.
Right.
Ballard, it was all about labels and what kind of car you drove and what your daddy did for a living and how much money you made. At Central, all that didn't matter. We were all just mixed in there together trying to figure it all out.
And that was unique.
It really was.
And it gave you a lot of different experience in terms of life.
It did. It absolutely did.
So did your sisters go as well?
No. There's a 5-year difference between myself and the next sister. So she was already off to college.
Oh, she was already gone. All right. So where'd you go to college?
I went to UK.
Okay.
I went to undergraduate at UK.
Are you a UK fan?
I am a UK fan.
Okay. All right.
I pull for U of L. I'm not.
All right.
I don't dislike U of L.
All right. I don't want to get angry either.
No, as a matter of fact, my stepfather, who is now deceased, was a cheerleader at U of L.
All right. Okay.
And my mother was a diehard U of L fan. My sister, who lives here, she's a diehard U of L fan. And I did get I got my graduate degree at U of L. I'm a Kent School graduate.
All right. So okay.
Yes.
Well, that's totally acceptable.
Yes.
So you have to root. Now, I'm an implant.
Okay.
So
Where are you from?
Born and raised in Chicago, Illinois. So I can say this. I root for UK in football.
Okay.
That's because the football team is not always great.
No, it's not.
Right?
No, it's not.
And I got my degree from UK.
Okay.
One of them. But I root for U of L in basketball. So it's different because U of L football is always good.
Yep.
So I root for U of L basketball. So, and I do root for U of L football, but I usually pick one or the other, so I'm divided.
I understand.
Right? But I stayed U of L fan, but I do root for UK football. So hopefully nobody will kill me for saying that.
No, I get it. And, and I'm really excited about the two coaches both teams have.
Okay.
Mark Pope, Kelsey, they just good people.
Okay. No, they have had really great seasons. I hated the seating for U of L. I thought, if you're number 2 in the ACC, you should be at least a 3rd seed.
You read my mind.
Yeah.
No, that wasn't right.
So I wish I could send an email to somebody to correct that for next year.
Right,
make up for it. So we have
the selection committee.
Right. Send an email to somebody. But anyway, so what did you study at UK?
I was a psychology major.
Okay.
I was a psychology major, and I wanted to be a psychologist working with kids who had experienced abuse, who had experienced trauma. And somewhere along my way, my advisor said, asked me a bunch of questions about psychology. Do you want to do research? Do you want to do statistics? And I said, no, I want to work with people.
Right.
And she said, then you want to become a social worker. And I said, really? What? In my mind, I didn't know what social workers did. I thought, well, don't they take kids away? Don't they work for Child Protective Services? Isn't that what they do? And she said, no, you want to be a clinical social worker. I said, well, what's that? She said, what you want to do? You want to do therapy. And so I did get my undergraduate in psychology. I was also just 3 hours shy of a minor in Appalachian Studies.
Oh, wow.
I love the
Oh,
Appalachian
wow.
people. I love Eastern Kentucky and the Appalachian Mountains. And then I graduated and came to U of L and went to Kent School when it was small. It was tiny. My class was the first class to ever walk the stage in graduation at Kent School.
Wow.
And one of my classmates, I'm proud to say, is Joanne James.
Okay. All right.
Yes, Joanne and I met each other when we were both at Kent School, long before she and Vincent ever met.
Okay.
Hello, everybody, and welcome to Park Duval. My name is Desmond Pritchard. I'm your Chief HR Officer here at Park Duval. I'm located normally 9 times out of 10 at the Wilson location. I'm beyond honored to support our community, to work with our community. There's a lot ahead of us. We have a lot we're ready to do, we're willing to do, and we can't wait to have you on board, to have you doing it with us.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at Park Duval Community Health Center. Ever since I started at Park Duval over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Hello, I'm Dr. Swanee Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you. What led the career path? I mean, what was your first job? Because you didn't just land to become president or CEO.
No. My very first experience, I was actually a volunteer at Home of the Innocents.
Okay.
Back when it was on Gray Street. And
I remember that.
I would volunteer on Sundays. I was 17 years old. And my job was to take the kids with a couple other staff. We would walk the kids to Walnut Street Baptist Church.
Right.
And we would go to church every Sunday. And then we would have visitation. And it was, I was just telling somebody the other day, in fact, I was meeting with Dr. Renee Campbell, a dear friend of mine. And we were talking about that. And I said, it was the first time I ever realized the bond between a parent and a child, that no matter how bad a parent treats a child, you don't break that bond.
Yes.
Because we had kids at Home of the Innocents who had experienced horrible physical abuse at the hands of their parents. Mm-hmm. But as soon as those parents walked through the door, those kids were so excited to see them. Mm-hmm. And
unconditional love.
Yeah, absolutely. I just remember looking, thinking, why? What's this all about? How does this happen? Right. And so that put me on the path. I spent almost 30 years of my career in child welfare.
Okay.
I didn't work for the state. I worked in the private sector. I worked at Brooklawn for many years. I worked in the psychiatric hospitals. And then I worked at Sunrise Children's Services as their first vice president of foster care.
So, and I remember a lot about Brooklawn over the years. What were some of the most trying times that you experienced as a leader?
I think the most trying times was when we would have, we called them residents, and it was all boys. And we had boys ages 18 all the way down to 6. And I think the most difficult was seeing the pain, seeing the hurt that these kids had experienced. And I'll never forget on Christmas Eve, getting ready to leave, and I had this one young boy say to me, "Miss Elizabeth, you going home?" And I said, "Yeah." And he said, "Y'all having Christmas tomorrow?" I said, "Yeah." And he said, "I bet you have a good Christmas with your kids." And I said, what's your think? What are you thinking? Because I thought something sparked him asking me these questions. Right. And he said, "I don't have anybody." And I knew that, but to hear him say that to me, to hear him say, "I have nobody in this world who I can call when I have good news, I can call when I have bad news, to celebrate with me, to wish me a happy birthday. And I thought, well, no wonder you act the way you do. I would too. If I had nobody in this world that even knew or cared that I existed, I'd be really angry. And that, again, just drove my passion even deeper, that everybody needs somebody to know that they matter. Regardless of what we've done in life, somebody to say you matter, you have value.
Well, it's a lot too in giving them time, because I remember working in a home when I was in college, and a lot of times it was just spending time with them.
Absolutely.
And making them aware there's something different. You can have a different path. And then I worked at a Job Corps.
Okay.
Right.
Yep.
So now I'm in my master's degree at UT, and trying to tell kids, because they was living there, there's a different path. You can't get to this particular level if you do these things.
Right.
But one thing I learned was that, and I'm sure you learned this, was investment.
Yes.
No, somebody had to make an investment in the. What challenges did you experience in terms of leadership?
In terms of leadership, it was getting staff, frontline staff, to understand why the boys would act the way that they did, and helping them understand to look beyond the behavior.
But you had the psychological part.
I did.
Right. So
To
how
understand the why.
Right.
Because they wanted to quickly react to what they saw as oppositional behavior. Well, he won't do this or he won't do that. And so they were real quick to want to force it, to take control, to make that child.
Right.
And I said, well, hold up a second. Have you understand the why? Why doesn't that child want to take a shower? What does water mean to them? Did something bad happen there?
Right.
Take time to invest in this young man to understand the whys. And I say that today. We hear so much about youth violence, and my question is, and I have the background, is why? Why did he do that?
I just saw the incident I was reading about in the paper and later piece.
Yes.
And that first thing that came to my mind was, okay, why did that occur?
Right.
Right? Because the kids, they all rebelled at the same time because of something.
Right. Exactly.
So,
even during times of the Breonna Taylor social justice movement, when we saw some things people were doing that people were very critical about, and I said, but why?
right.
There's anger there.
Yeah. It didn't just
And it's
arrive.
probably very justified anger.
Right.
And I want to look at, have you ever gotten so angry that you did something you think, oh, I shouldn't have done that? I'm sure we all have. But so that's, trying to get frontline staff to understand the whys.
Right.
And we talk about that today.
Well, even the frontline staff, but your leaders.
My leaders.
Right? Because everybody, I tell people all the time, some people take a job.
Right.
Right? And some people, it's their life, what they believe in. So you have a call and a mission. You try to hire people that are like minds.
Yes. Yes.
Right? But then once they're bored, you're like, uh-oh.
Exactly.
They don't have that same passion as I do.
Right.
And how do I give it to them?
Right.
So you talk about the why, but how do you motivate people?
I try to motivate people by role modeling.
Okay.
I try to motivate people by getting them to see the impact of their behavior, not their intention, but their impact of their behavior. Seeing if they would just, come watch me interact with somebody. Let me coach you. But building the relationships. At the center, we deal with people who have experienced horrible trauma. Well, that trauma is going to show up in different ways. It might show up in drug use. It might show up in anger. It might show up in depression. But if you sit down and you have a conversation and, again, understand the whys and understand the background, your perception of this individual is going to shift.
Right. Now, I haven't been to the facility in years, so
Okay, we'll have to get you there.
you have to get me there.
Please.
So remind me of all the services that you provide, because you do a lot.
We do a lot. We absolutely do. Well, one thing that we do is we're 24/7, 365 days a year. Don't ever close. Never have closed.
Right.
We have a 24/7 crisis hotline, so anybody can call, whether they're just calling to get information, whether they're calling to ask a question, whether they are at the height of horrible physical abuse. We will get you in a safe place. We will walk you through that. We will, what we call safety plan with you.
Okay.
Then we have our community services. So we're in Jefferson County and the 6 surrounding counties, and we're in court. We support individuals going through family court when they've taken out emergency protective orders. We also do case management. So we're going to work with you on maybe you need to find a new place to live, maybe you need to go back to school, maybe you need to find a job. What do you need to get in a better place? We're going to work with you on that. We also relocate folks. When people are fleeing domestic violence or sex trafficking, we might relocate you if you can identify and we can confirm a safe place for you to go. We do counseling, we do therapy. We do what we call hospital runs, meaning that anybody who goes to a local hospital for a sexual assault or domestic violence injury, and we get called, we'll come in there and we support you.
Hello, I'm Dr. Swanee Jett, CEO for Park Duval Community Health Centers. We conduct WIC, nutrition, and open enrollment for healthcare. So this is a one-stop shop facility for everybody in the community. Tune in to CEO Live Talks with Dr. Swanee Jett every Saturday at noon on Wave 3. In this thought-provoking series, we bring you conversations with influential leaders, visionaries, and changemakers who are making a difference in their communities and beyond. From healthcare innovation and public health initiatives to community building, each episode offers a unique perspective on the challenges and opportunities we face in today's dynamic landscape. Join us as we explore the stories and insights of these inspiring individuals and gain valuable knowledge that can drive positive change in your own life and community. Don't miss an episode. Mark your calendar for Saturdays at noon on Wave 3 to watch CEO Live Talks with Dr. Swanee Jett. Together, we can shape a brighter, healthier future for all. Hello, I'm Dr. Swanee Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you.
My name is JT Douglas, and I am the Director of Development and Marketing here at Park Duval. I'm in charge of all of the fundraising efforts to help us do some of the great work we do here at Park Duval. The people that come to Park Duval, they're here for a reason. They're here to see us. They're coming to the health center because they don't feel good. And I think it's great work that our physicians and providers do for those patients by helping them.
Now, I know your name just says, in the name, it says women and families, but there are statistics that show that there's a number of men that is involved in domestic violence. So what do you provide for men?
The exact same services.
Okay.
We're in conversation as I speak about rebranding because it is a misnomer.
Right.
We serve men. We serve anybody and everybody.
Okay.
Our role is not to ask you what your gender is, how you identify. We don't ask you your immigration status, because if you are a survivor of intimate partner violence, sexual assault of any that, you qualify for services.
Okay.
And then, of course, we have our shelter, which holds up to 80 individuals.
Now you said immigration, so I'm wiping my eyes right now because has ICE showed up?
No.
Okay.
No.
All right. I had to ask the question.
We are private property.
Mm-hmm.
We have locked doors.
Okay.
I have consulted with a number of individuals in this community.
Right.
My role is to keep people safe, and that's what I will do.
Yeah.
Because that's why they're there.
And I serve everybody, so I understand. But
Yes,
I had
you
to
do.
have that
Sure,
question
absolutely.
in my mind as well. Like, do I need to lock my doors? Because
Well, for the work that I do, more than 40% of my budget is grants, and it's
Right.
federal grants. But in those grants, they say, we serve everybody and anybody. We serve undocumented. That's expected of us. The laws in Kentucky say the same thing.
right.
And so until there's a law change, I'm going to follow the law.
Yeah, I understand, and we're about the same thing.
Yep,
So
absolutely.
I understand because I get 5.6 million from the federal government.
Mm-hmm.
So same thing. So one of the things that I mean to ask, and I've seen some of the data from years ago,
Sure.
but for men, I don't know if it's true. Is it still underreported?
Yes.
The amount of domestic violence.
It is.
And so my thought might be different than your thought. I think a lot of men just don't report it because of shame.
I still think that's this thing.
Okay.
I think men, because in the conversations that I've had with the men that have reported it, and I said, what led you to report it?
Right.
And they said, many times they have children, and so it's not just me I need to protect, it's my child.
Okay.
And they'll say, I'm not going to hit back. I'm not going to become violent as well.
Right.
She chose to do that, for maybe a number of reasons. Sometimes there's drug addiction involved. But I'm not going to retaliate, and I'm going to keep myself and my children safe.
Okay.
But I do know, and they have said to me, but people give me a hard time because they'll say, well, you're a man, you're bigger than her.
Right.
He said, it doesn't matter.
Right.
I do know that if I hit back, my hit's going to be harder than her hit.
Correct.
But then I'm going to jail.
That's right. That's right.
What happens to my kids?
Right.
So I respect that. Men have every right to report it, as well as sexual assault.
Right.
Men also experience that. And so it's important that men know that they have a safe place to come to get the help that they need, to mitigate that trauma, to get, go to the hospital. We have a clinic in our building where people can come and get exams. So men can come to our clinic. They don't have to go to the emergency room and worry about running into anybody or dealing with all the craziness. Come to our clinic. Let us be there. Let us walk through this with you, because you need to be checked out.
Now, if something happens in the middle of the night, do you have a place where they could stay?
If somebody comes to our clinic and it's not safe for them to leave, then we will put them in shelter.
Okay. All right.
Yeah.
Can you protect them? Okay.
Our
Like,
building-
if you have to call police or
Yes,
to have somebody stand by, okay.
absolutely. We can do that. And we don't force people to report. That's totally up to them. We'll ask people, do you want to report? Sometimes they say no, and then 2 days later they say yes. If they say yes, then we'll go ahead and call the police. But we don't automatically do that because, as we believe, a survivor knows what they need in that moment, and we're going to respect that.